Dr. Demetropoulos, let me congratulate you again for being elected mayor of Pascagoula. You and I go back quite a ways. You actually were president of the State Medical Association a couple of years before I was. And we've had a mentor-mentee sort of relationship. But all along, we've always talked about physicians and how important it is for physicians to be engaged in political activity. And we've also talked about why it's important for physicians to seek elective office so that basically your influence can be more broad as you impact citizens and as you make circumstances in your community better. Physicians have long been on school boards and done a lot of other things, but I think we need to go a step further in other elective positions. You obviously believe that also. So tell me, in your mind, why is it important for physicians to engage in the political process and seek elective office?
I think at the heart of that question is kind of this idea, and it's a challenge to physicians, and here's the tension. I work hard every day. I take care of patients every day. I give myself to other activities with my family. Where do I get that extra energy? And but on the flip side is, if you're not going to do it, who will do it? And oftentimes I think we have to look at, again, I hate to use this word, but we're uniquely qualified just by virtue of what we do. We bring so much to the table on how we can solve problems and how we're, our attention to detail and the way that we collaborate with people. So if we don't do it, somebody else is going to do it, right? And so that's the answer for up here at the state level. And if we don't have a seat at the table, we won't have a seat at the table. Somebody else will take our place. At the heart of our communities, like what I'm doing, it's just purely for love of my community. And our doctors, I think there's this barrier in their mind, like, how could I even possibly contemplate it, or how would I go through the steps? And I'll tell you what, if you're interested, call me. I'll be happy to share my experience. It's not as hard as you think. And I don't think it'll be as daunting as you think. And I think that once you start doing it, you'll get that same level of gratification that you've got in treating your patients and solving problems with them and their families. You'll get that same level of gratification in fixing bigger problems around your community.
I think one follow-up on that, I think as you're suggesting, as physicians, we take care of patients, and we take care of them, we take care of their families. And in that process of having that physician-patient relationship, we hear about other things in their lives. Sometimes we talk about the social determinants of health, and it brings in everything in their lives that impact them being whole and healed. And I think physicians do bring a unique perspective to that. And so in my mind, it's a natural progression for physicians to want to do the rest of it as we heal communities and families.
Right. You're absolutely right. We have such a unique experience. So I was asked some questions about homelessness and how would address it in our community. It's so interesting because I've been treating homeless patients through the ER for all these years, and they fall in a couple different categories. Some people have dependency issues. Some people just have a really misfortune that come into their life. Other people have issues with mental health. And some people, it's a lifestyle choice. But knowing how to bring all the people together, be problem solvers around here, we're used to working with social workers. We're used to having case managers. We know how to get the right people around the table. And it's like what you say, just the experience of what we do on a day-to-day basis. We just translate that to solving bigger problems in our community. The other part of it is just that are we able to kind of see that we can balance the time? And sometimes, particularly for me, it was getting a little bit later in my career, and I thought, okay, what do I want my legacy to be? Okay, I've spent my life, working, raising my family, and contributing to my community, but how do I want to go out strong, and how do I want to get back? And so this is another part of it is that I can spend my time a lot of different ways, but most of us as physicians, we got in it because we wanted to serve other people. And that's why we got into medicine. We wanted to serve other people. This is just another opportunity for you to serve other people.
Thank you for being a fine example of the ultimate healer as you bring forth and those things that we as physicians actually take an oath to do, to heal in whatever communities that we go into. And you are the ultimate living embodiment of that. Thank you for all that you do for medicine and for your community.
Thank you. I want to say one other thank you is that nobody does anything of significance unless they have people that help them do it. So all those people that came before me in state medical that were encouragers and mentors and people that helped me learn how to be active at state medical and a better doctor, and then all the people that are in your family and your life and your friends. You don't get any place without having people that you have to say thank you, because you're not there by yourself. Other people helped you get there. Thank you.